Hi, Dr. Wilson. Thank you so much for being here. How are you today?
I am wonderful, Dr. Mayo. It's wonderful to be here with you.
Yeah, I'm excited to share your story with our audience. Why don't we start by you telling us a little bit about yourself? Who is Dr. Tracy Wilson?
Well, I am a mother, a wife, a sister, a fellow nurse practitioner, and I work in industry. Just here to share my story as a wife that is a caregiver to her spouse that is currently undergoing treatment for multiple myeloma.
Yeah, that's amazing. So you said industry, so you work for the pharmaceutical industry. Is that correct?
That is correct.
All right. So you are a nurse, you work in the pharmaceutical industry, so you're fully aware of research and the development of medications, the importance of that, but you are still considered a cancer caregiver.
That is correct. That is
Yeah,
in the trenches.
yeah, yes. Because I think sometimes people think that, it's just me, but as professionals in healthcare, we also experience the same things, such as, our family members becoming cancer patients or us ourselves becoming cancer patients. So, why don't you tell us when you became a cancer caregiver? What?
Um, Absolutely. So back in 20 out in I'll kind of, go back and forth between the timeline. So officially in 2017, my husband came back from a boys trip from the Dominican Republic and was really, really sick. We had to take him to the emergency room because he wasn't keeping any food down, and so turns out that it was salmonella poisoning
Mhm.
that he had. And when they drew the blood work, his white count was zero,
Mm.
negative, if we want to say. And so the emergency room doctor that we saw said, his counts are really, really low. So in about a week, he needs to follow up with his primary care provider to make sure that his numbers have rebounded. And so I said, absolutely, I'll make sure that he does so. And so luckily at that time, I was still working in my urgent care, and my medical director was his primary care provider. And so that week later, we followed up with his with my medical director, his primary care provider, and we were at the appointment, and he looks at me because. We have the relationship, and kind of looks at him, and he says, Tracy, his numbers do not look any better.
Mm.
Um, and they should have rebounded by now. So I'm going to go ahead and send a referral to HEMOC, so the hematology oncology. And so me and my husband kind of looked at each other, kind of suspiciously. And for my husband is familiar with science and those terms and stuff because he's in the pharmaceutical industry as well. And he's a sales rep. So when he said that, that kind of made my husband a little suspicious as well too. And so that started us on a very long journey for about 6 months of trying to figure out what was going on. Numbers still, were very slowly responding back. But then he had other things that were abnormal in his labs, protein in his urine, and other things. And when he finally got to the hematologist, oncologist that he saw, they actually decided to go ahead and send him to Vanderbilt to the stem cell transplant guru that was there, because with him at that time he was 39, and that oncologist did not feel comfortable with diagnosing him officially, and so he wanted to have his mentor be the one to do all of the final testing to ensure that what he was looking at was actually what was the final diagnosis that December of 2017, which turned out to be multiple myeloma. And so that's what he officially got diagnosed, which was the day after Christmas. We got the phone call, which was multiple myeloma.
Wow, and during that time of being worked up, because it sounds like you went to the primary care doctor, then you went to a hematologist, then you had to wait and go to his mentor to get the final diagnosis. During that time, how were you coping? What were your thoughts? Did anybody provide you with any resources or support at that time? What were you doing as the caregiver?
I mean, just really supporting him. I mean, answering any additional questions because I was also working at that particular point and getting ready to take on a new job. We had at that point, a 4-month-old son. And so, we had our oldest daughter as well too, and she was just around 8 years old. So, managing the household, managing the kids, I was traveling for work. So really just being there to answer any additional questions, being on calls, attending what appointments, mean that I was able to be at, that I could, and then, being on then Zoom calls. And I can remember just one of the calls when they were really trying to decipher whether it was MGUS or again, if it was multiple myeloma, or whether it was smoldering. They were just, again, his giving credit to his oncologist. He was just not going to give this diagnosis until he was 100% sure. But I want to back it up just a little bit, was that he, um, for about 3 years prior to his diagnosis, he was having back pain. And
Mm,
if you know the symptoms of multiple myeloma, these he was having some of those classic symptoms. And my husband was a previous collegiate basketball player, and so he went and saw a orthopedic doctor. He saw a physical therapist, and then eventually saw an orthopedic surgeon where he ended up having microvascular surgery for the back pain. So there were, a lot of, I mean, we'll just call it what it is. Unnecessary testing, unnecessary surgery, because at the end of the day, what was really going on with him was the lesions from multiple myeloma that have built up in his spine and his vertebrae. And so, had maybe someone did some other testing, he
mhm.
could have been diagnosed a little sooner. And so that was one of the things that for us, as we have now become, advocates and champions for this illness, is to talk to people, especially people that look like us, is if you're feeling something, if something is feeling abnormal, is to advocate for yourself and ask for additional testing. And if someone is not listening to you, then you find someone that will listen to you to ensure that you get the right necessary testing for yourself.
Yeah, that is so important. Advocacy is so important as a caregiver, as a cancer patient. Can't stress that enough. But you said something very key. It's really knowing your body and knowing when to advocate. So, your husband was having back pain, didn't know, right? But couldn't advocate to say, hey, I think you should do additional testing. But I think also in terms of advocating, and I would love to get your thoughts on this, but your husband saw one hematologist, a primary hematologist, who didn't want to make the diagnosis, but then sent him to his mentor. I want to talk about second opinions. Did you guys consider that a second opinion? Because that's a lot of questions we get about, is it okay to get a second opinion? I'm always for, yes, get a second opinion so you can hear it and you feel good about the decision you're making.
I am a huge, huge, huge advocate for second opinions, and I do talks on medical gaslighting. And that's one of my last takeaways that I leave people with is it is your right. It is in the
Mhm.
patient bill of rights that you are obligated and can get a second opinion because your very life could depend on it. So get a second opinion, and then especially if your instincts is telling you something just doesn't feel right. And if you're asking those right questions and you feel like that you're being not heard or seen or valued in your appointment with your healthcare provider, then it is your right to get a second opinion. So absolutely.
Yeah. Yeah, no, I totally agree with that. Patients are always kind of like, well, I don't know. I don't want them to feel bad. I was like, this is your life. It's not about who's feeling bad. And if you have a oncologist or hematologist that does not support you getting a second opinion, I think there's other questions we need to ask. So,
Absolutely,
yeah.
absolutely. I think another thing that I would want to mention while we're having this conversation is even being again a healthcare provider and being being that caregiver is making sure that you're having someone come to you during these appointments, because there are a lot of things that my husband did not hear during these appointments. So having someone there to capture those notes so that you can have those discussions later on. Well, did you hear this? Did you hear that? So having someone there to capture some of those notes. But then two, for us, again, being, relatively young, and hearing this type of information, when we went to that first really big appointment at Vanderbilt and having that end of life conversations,
Mhm.
and they're talking to us about, well, what would you like if this happens? What would you want if this happens? And what would you want if this? So going through all of those necessary conversations with him, I mean, I would tell you, it took my breath away,
Mhm.
and it definitely took my husband's breath away. So if you haven't had those conversations prior to a devastating diagnosis, I implore you to have those conversations long before the emotions set in
Yeah.
and you are hit with something like this. So that was one of the things after this that
Mhm.
we did, that we start talking to our families about. About 2 years later, my mom ended up getting diagnosed with colon cancer. And it was the same thing. We hadn't really, delved real deep with my mom around these same kind of questions. So again, have these conversations before these devastating diagnoses hit your family, because it's really hard to talk about this stuff when you're faced with these difficult diagnoses.
Yeah, absolutely. And Dr. Wilson, it seems like you are juggling a lot. You're juggling the kids, you're juggling the new job, you're juggling the appointment, you're juggling your husband's emotions. How did you do it? What was was you just keeping yourself busy so you'd have to think about it? But how did you maintain that balance between, or flow rather, between all these different things during this time?
Oh, what Dr. Mayo, it crashed and burned. Don't worry about it. Don't worry about it. The car crashed and
Yeah.
burned into the side of the highway, actually, because my husband got diagnosed that December of 2017. Then my dad, that January, then had multiple strokes and then was diagnosed with vascular dementia that January of 2018. And so we ended up bringing my dad down to. We were living in Tennessee. We brought him down to Tennessee for his rehab care. And so juggling new job, kids, husband that is now starting his cancer treatments and then starting the journey to eventually head towards stem cell transplant. By that March, I had burnt I burnt the candle. Forget the statement of burning the candle, around. No, I burnt the candle down. And so
Wow.
eventually went to the hospital for chest pain. Luckily,
Mhm.
the The EKG was it did show some slight irregularities, where the cardiologist, he did want me to go ahead and undergo um, the cardiac um, um, evaluation, where they
Like an
um,
angio?
yes, basically, and just take a look at my vessels
Mhm,
and
mhm.
all of that. And so everything was fine. He wanted to err on the side of caution because it wasn't, my EKG wasn't so abnormal, but he wasn't 100% sure. So he just wanted to be 100% sure. So he went ahead and did that. Vessels were all clear.
Thank God.
No calcium, no, nothing. And he said, at least you have the, knowledge to know that you don't have, any buildup in any of your vessels anywhere. And so you can now walk through, kind of life for at least the next, 30 years,
Yeah,
um, right now. But it did kind of shake me,
yeah.
you know, you have to take care of you, because if you're not good, you're not going to be here for kids, husband, dad, the rest of the family, no one. And so I began to do a lot more self care,
Mhm.
and doing a lot more of things that would fill my cup so that I could at least be around to pour a little bit more into other people's cups.
Yeah, absolutely. And then in retrospect, what would you have done differently? So maybe you could have prevented, going to the hospital with chest pain. Thank God everything was clear. But in retrospect now, because I'm thinking about new caregivers, right? They get the diagnosis, and I think you're so overwhelmed with daily life, then this is dropped in your lap. You're concerned about your loved one, how they're feeling, how they're handling it while you're going through your own emotions. What are some things you think you could have done retrospectively that may have maybe mitigated, not saying that you wouldn't have went to the ER with chest pain, but because you said you started self-care after that, right? It was like a reality check, like hello.
Uh, I think number one is, without a shadow of a doubt, admitting that you need help. And
Yeah.
even though I thought I did, right? I thought I was asking for help. But, I mean, just realizing that you're not Superwoman
Hmm.
are Superman, that you need help. So taking on, delegating tasks. It's kind of like in leadership, that you delegate out things that just really could be delegated out, that you can't do it. So when those people are asking, well, do you need me to do anything? And you just, out of politeness or courtesy, no, I'm okay. I'm fine. No, quit being courteous and polite. No, can you come and help me fold some of your clothes?
Right. Right.
So yeah, so just some of those things, just be a burden sometimes.
Mhm,
Yeah, because
mhm.
then that'll test if some of those people truly being genuine, and are they just saying that out of a nicety.
Yes, yes. And what do you think from an employer's perspective? How can employers, support caregivers during this time?
I guess just ensure that when they need the time off, you know, give them that time off. Luckily during that particular time, I was working for a really good company that just, they were not pressuring, me about work, be there for your spouse, take care of your family. So when they hear about this information, that it's not about work. It's, when they talk about work life balance, that the life becomes the most important thing, that the work will get taken care of if they're really about that work life balance. And so if, the PTO, if they don't have the PTO, that is not about that.
Hmm.
Let them take the necessary time off to ensure that their family, because that's just not the stress that you have
Right.
to be thinking about. Let them take care of their family.
Yeah, absolutely. And how did you and your husband tell the family, friends, and children? Because, I always think about cancer like you're living your life, everything is fine, then boom, life just shifts like in a matter of a second. And then you have to like get your breath and then come back to say, okay, now what are we doing? Like, but I think the hardest thing is it's just for you and your husband. You have your feelings about it, but then how do you have the conversation with your family, your friends, and especially the children?
Right. I think for us, it was a little hard because we had young children.
Mhm.
So, it's kind of hard. So, of course, our son, he was too young. Our daughter, it was a little different for her because, I mean, she was aware, but not aware to the depth of what was really going on. So she just knew that, one, daddy didn't always feel good,
Mhm.
but and then when he started prepping for the stem cell transplant, then she knew that, when he started to lose his hair,
Mhm.
and then he shaved all his hair off. So then she noticed the difference, and so why, daddy, why don't you have any more hair? Where did your hair go? So he kind of had to, explain in the most simplest form where, what happened to his hair. And so it wasn't until probably maybe a year or two later that he really kind of explained
Mhm.
what is going on with him, and kind of gave a name to it.
Okay, and that's for everyone, family, friends.
Well, not that was just for the kids. His
Okay. Okay.
his actual family, and actually, when he got the diagnosis, he actually told his mom,
Mhm.
um, and his mom had a hard time.
Mhm. Of course. Of
Had a hard time and didn't want to believe it.
course.
And I tried to kind of chime in, to give, a little bit more deeper explanation to it. And so she kind of shut me down too.
I don't wanna hear I'm not ready. Right.
And so it took her a little bit
Mhm.
to kind of just grapple. And it was more, we just wanted her to be aware
Yeah.
of what was going on. But she eventually, again, because we just needed her to know, for support and prayers and all of that. And so, and I think when we talked about it, I said, well, and I think I forewarned him. I said, well, she's probably not gonna take it very well. And he was like, well, I think she'll be fine. I was like,
Yeah. Yeah. Yeah, but I think that's a good point. Everyone's not ready to receive it,
okay.
right? Whether it's, mom, dad, kids, friends. People are like, I'm not, I'm just not ready. I'm not ready to have the conversation, which I think is a good thing. But it's us respecting that, like, okay, well, I told you, and when you're ready to talk about it, I'm here. So
Mhm.
so that's good. And another question I have for you, and I feel I find myself in this situation all the time, being in a nurse practitioner in oncology, specifically when my family was diagnosed, my aunt was diagnosed with a brain tumor. How
Yeah.
did you balance being the wife and being the healthcare professional?
Oh, I think I think that's always a balancing act,
Hmm.
and I think that still is ongoing. The balancing act. You don't want to impinge upon his where he is, and with him being already in pharmaceuticals, so his knowledge base is probably better than most. And so I offer my assistance and my knowledge where he wants it.
Hmm. Mhm.
And so I try not to impinge too much in that area. And then, when he asks, well, what's this? Or, or what's that? And I, oh, okay, okay, here it comes,
Right.
here it comes.
I'm
um,
here. I got the answer.
exactly, exactly. I think I think that's, what I've tried to do really from the beginning is, me, as they, try to say, me in the Bible, you try to be the helpmate
Mhm.
as much. And, and, the more you want, I'll be, and pull back, because I don't want to be too much, because I know,
Right.
some too much help can be too much, but too little
Yes.
can be, well, I don't want that. I want the help. So I try to, as we like to say, read the room, and try to, feel where he really needs me, as much as possible.
Yeah, yeah. Now, in your journey, when would have been a good time for the healthcare professional to offer you assistance? So, if they, offered you family therapy or, send you to an advocate, when would have been a good time for that? The beginning, during, after, now? When do you think would have been an ideal time where you could have said, I could have used some help. I could have used some direction. I could have used a partner.
I would I would say probably at the beginning. I
Mhm.
mean, I would say day one. Day
Yeah.
one. I think that's where you're gonna need the most help, the most questions, the most everything, and how to navigate the system, and the resources. We 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 fell into, and I call it really felt that way. Fell into a partnership with, a Leukemia and Lymphoma Society, and we have just done some really great work with them. But the resources that they have, what I mean, for patients that are diagnosed, with, what I mean, a variety of different, cancers. I mean, again, this illness costs so much money. The variety of different assistance that they have, from copay assistance to helping to pay for your rides back and forth to the doctors. When he went through his stem cell transplant, I mean, they had assistance that could have taken us back and forth to the hospital when we were staying at the hotel.
Wow.
It's been simple stuff like that.
So you said you fell into it, so no one proactively gave you that information or
No,
connected you?
we weren't aware of them. We knew about some other organizations, but this one we weren't aware of.
Very interesting. Yeah, I think that's the disconnect. There's so many services and resources out there for cancer patients, survivors, and even caregivers, but it's who's making the connection and when is it happening. So that's the gap between, healthcare organizations who, their primary focus is treating the cancer, yes, but there's so much more that goes into that, such as a referral to, a foundation or organization.
Mhm.
Um, so during your time of being a caregiver and your husband being a patient, did anyone address your mental health or his mental health in terms of assessing him for anxiety, for depression, for anything? Was that ever a topic of discussion?
I think it was mentioned, like almost like a checkbox, right? I mean,
Mm,
you're make sure you if you have issues, you know, see somebody.
mhm.
Um, but as far as an actual, a rating scale or scale or anything like that, I no. But for him, he actively sought it, and actually, because he will tell anyone that he could not have gotten through this without, mental health treatment and
Wow.
seeing a counselor. He could not have.
Yeah, that's amazing. And I think, I commend him for that because as I said, cancer kind of comes and kind of disrupts your life. And I always say that, sometimes it makes you question your identity where, I am this person. I don't believe in therapy. I don't whatever. But when something like this happens, we have to reevaluate. And like you said, get the help, seek the help, ask for the help, advocate for the help, and mental health is so key, and that's why we're around collaborative cancer care, right? Because we want to partner with you. We want to make sure, because for me, if you're not mentally okay, nothing else is going to work out, right?
Mhm.
It's going to be hard, but it's so important to address them. And so I commend your husband, for seeking counseling and mental health during his journey.
And I did too, because again, what you have to understand, and it's okay to feel that you don't like your partner during this journey. It's okay. You all are not going to like each other. And that's a safe statement and a safe feeling to have. And when I was, seeing my counselor, during, really during the thick of it, those were, that was made okay for me to feel that way, because you're thinking when you're in the thick of it that it's always supposed to, one, rosy feelings, but you being this caregiver, you're supposed to always this altruistic,
Hmm.
feelings about being a caregiver. No, no.
Yeah.
Sometimes you mean, and when you being mean, I'm not gonna like you. And that's okay for me to feel like, no, I'm gonna walk away because you still my spouse and
Hmm.
not having a good day right now. So
Yeah, absolutely. That is so real, and I'm so happy you said it because emotions are high, things are different, a lot's going on, right? I'm not gonna like you every day, right? But it's creating that space for yourself where you feel safe to say that, right? And someone validates that, yes, that's okay. That's okay. So that's amazing that you seeked counseling and then your husband seeked his own counseling. I love that. And you did that independently. No one referred you. Yeah.
exactly,
Yeah.
exactly.
Yeah, I love that. And how are you doing now, Dr. Wilson?
I'm doing good. So I'm doing, work. I mean, we both, speak as advocates, me on behalf of, multiple myeloma. So he does work in the oncology space. So we find ways to, to give back, and, find passion, in this area.
Yeah, I love that. And your husband seems like he's doing well and he's thriving.
He is, and so he's with his disease, he's me fighting back and thriving, as we like to say. So absolutely.
Amazing. So, if there's anything you can tell a caregiver that, maybe starting their journey, what are some key takeaways you can provide to that caregiver?
I mean, again, I think one of the things we already have established is, self care. So take care of yourself so that you fill your cup, so that then you have something to offer back to everyone else. Um, I would say probably if I leave with one key takeaway that we probably didn't touch upon, is activate your village,
Mm,
please, please, because when we were getting ready to do his stem cell transplant, and my husband is in a fraternity, and one of his fraternity brothers came up to the hospital while we were finalizing the dates on his stem cell transplant. He asked, "What do you need? What do you all need?" And I explained, well, we're going to be, staying at the hotel while he is, in quarantine, because we couldn't stay at the house because we have young kids. And so I said, well, we're going to be in quarantine, and the kids are going to be at the house with my mom, and some family members going to help out there, and so we're going to be in quarantine. And so there's just going to be a lot of that kind of back and forth and things like that. And so he was like, okay, well, I'm gonna come up with a dinner train for you all. And so I'm like, oh, that'd be so nice, for the house. Well, not only did he come up with a dinner train, the dinner train that he came up with was for where we were in the hotel, but also for our house. And this was for 6 weeks, every day. His
Wow.
fraternity brothers fed our entire family every single day. Somebody brought us meals.
Wow, I have chills with just hearing you say that, because you did activate that. You didn't say, "Oh, no, 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 no. No, no, no. It's okay. We got it. We're good." You said, "Okay." That's it. Okay. And it was done, which is amazing. It's letting people in, let people help you.
Mhm,
So big. Let
mhm.
people help you.
Yes.
I love that. I love that. And one thing I didn't ask you that I would love to know is, what does self-care mean to you? What does that look like for you?
I'm gonna be shamed. You putting me to shame. Um, So I love, I love movies. I love travel. Me and my husband love to travel. I mean, since his diagnosis, for him, it has activated traveling for him. He's gonna see this big old world, as he like to say. So I feel like he has this dark room with a glow in the dark globe, and he spins it around and puts his finger on a place, and we go there. So that's what we do now, since his diagnosis. But for me, I think what feeds me is the traveling, movies, and then because my job is very taxing to my brain, Ratchet TV, Ratchet
Oh
TV.
yeah. Oh yeah. Yes, absolutely. Because it removes you from reality for a while. You're like, oh, did she do that? No, no. So yeah, I love that. I love
It
that.
really, yeah.
Yeah,
See,
yeah. And
that's
it's what works for you, right?
exactly, yeah. And so besides, getting my hair done and nails done, those kind of things too. So
Yeah, yeah, I love that. I love that. Well, Dr. Wilson, this has been amazing. Thank you so much for sharing your story and your husband's story with us. I know you definitely dropped some gems that's going to help someone.
absolutely, my pleasure. All right, and I appreciate